morning, everyone. I've just woken up and I'm ready to go to work. But today, I feel like sharing with you an incident that occurred to me. And while at home, our cat bit me. Actually, I should show you my finger. You can see some dot there. Those are teeth marks. Our small kitten was fighting with our German Shepherd, and when our kid called me to go and rescue the kitten, I ran there, and as they were fighting with the dog, accidentally the kitten bit me on my thumb, on my right hand side. It got me worried because being a medic, I know the risk of rabies. Rabies can come through cats if they are infected, dogs, skunks, coyotes, raccoons, bats, and so many other animals that may be bearing the virus. Actually, this virus is from the family Rhabdoviridae, and it is transmitted through saliva from an infected animal, even a person who's infected. If that saliva gets in contact with you, then you end up with the virus also, and you can get the disease over time. Now, why I was worried about the bite is that the kitten was new. We do not have the history of vaccination of that kitten, and our dog was vaccinated. We usually vaccinate as it is recommended, but now this kitten, we don't understand whether it was vaccinated or not, and what it was bearing the virus. So when one has this infection of rabies, they will develop fever, hotness of the body, headache, which may also be severe. Some patients have hypersalivation. They produce a lot of saliva, and some may have muscle spasms. The muscles go into spasm, or sometimes patients may get paralyzed, or they go into coma and then they die. So this is my worry. I may not know when I will develop these symptoms and signs, but so far I've gotten the vaccine. I went to the hospital and I was vaccinated. I have a very painful shoulder here. This is where I was injected. Usually when one has a suspected infection, or has been scratched or licked by a suspected dog or an animal, they should be given a vaccine to reduce the chances of this virus getting attached to the nerves. This virus is neurotropic. Once it gets into the body, it usually gets straight into where the nerves are, and it disorders their function. So when one with a bite from a suspected animal goes to the hospital, they usually get a vaccine on the first day. That is when they present themselves to the medic. That first day they get the injection is called as day 1, or day 0, I mean. And then after 3 days they go back and get another jab. At the 7th day, from the first time they had an injection, they also go back and get injected, and on the 14th day. So those are 4 jabs that they should get. For those who are immunocompromised, for some reason, they get the 5th injection on the 28th day. So this is the recommendation from World Health Organization that people should follow if an accident does occur where you get bitten by a suspected animal, of having rabies. You shouldn't wait to see the animal behaving in a way that will suggest that it has rabies. All animals should be suspected as having rabies, so that any person, any kid or child, mostly children are the ones who get exposed to rabies because they play with animals at home, especially if those animals are not vaccinated as it is recommended. So treat any animal as unvaccinated and go for vaccination or treatment at the hospital before symptoms arise, because if you wait and the symptoms start, it is known that uniformly this disease kills. So very few people survive from this infection once it occurs. So go for treatment before any symptoms or signs set in. Something else that should be done is injection of rabies immunoglobulin. Rabies immunoglobulin is given onto the wound or surrounding the area of scratch or the bite. You infiltrate, you inject into that wound. Most of it, the remaining is injected to some part of the body, like in the deltoid or the quadriceps, the anterior or the front part of the thigh. Those are the options where the immunoglobulin can be injected. So the immunoglobulin also tries to reduce infection, the virus getting into the nerves. So immunoglobulin, together with the rabies vaccine, they try to reduce the risk of the disease occurring in the person who has been bitten or scratched or even licked. Yeah, so another way of preventing the rabies virus or infection is once one has been infected or exposed to a potential infection, they should wash their wounds or the area that they have been scratched for at least 15 minutes continuously with soap or iodine or even any detergent that may be found at home. So continuously wash for about 15 minutes to reduce that risk, because it is thought that the washing would take away the viral particles, reducing them from the body and therefore reducing the risk of infection. So that is something important that people should know as they live wherever they are, and especially during this festive season when kids are at home and maybe playing with animals. Another way you can prevent this exposure or infection is don't confront animals. Kids or even some drunk people or those ones who are adventurous, sometimes they want to attack dogs, even the stray ones. You may not know whether they are infected or not. So avoiding confrontation with these animals will prevent you from being exposed to the rabies virus. You see, I went in good faith to rescue our kitten, but in the process I got bitten. And by the way, that kitten later died, and I even was wondering, why was I risking my own life trying to rescue a kitten that was going to die? Yeah, so confrontation should be avoided. Another way is regular vaccination of animals that are supposed to be vaccinated, like I said, the dogs, need to be vaccinated for rabies or against rabies. The cats, the ones which are domesticated, so at least once a year. But there are protocols from country to country, so follow them. The animals should also be controlled so that they don't mix with the wild ones, those ones which are wandering, the mongrels. So fencing of the homestead will prevent the dogs from getting exposed to these other ones from maybe the neighborhood of from the forest, that are likely to be infected. Then when you build a house, the roof should be sealed off completely to prevent birds from nesting. Those birds are known to be bearing the virus. Not only the rabies virus, they can also harbor the Marburg virus, which also presents differently, but it's also fatal. So sealing off during construction of the roofs will prevent the virus being around and therefore reduce exposure. So I may not know how it will go. I'm still undergoing injections, 3 more to go. I hope that all will go well, but if things turn as they would, we leave that to God. So thank you, and take care wherever you are. Don't get exposed to the rabies virus.